Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week of July 5th. I hope everyone had a happy and healthy July 4th weekend. As you know, we've been following this pandemic for some time. I think it's worth looking back a little bit. By the end of January of this year, there had been about 130 deaths reported around the world. That number hit 1,000 within a couple of weeks, past 5,000 about 6 weeks after that, and has been growing steadily ever since, such that by the last week of June, it had hit over 500,000 deaths, and now we're at 534,000 deaths around the world and 11 million confirmed cases. If you look at deaths per million, which tells you how significantly impacted any particular country is, these are the top 25 countries in the world. And even within this top 25, there's a pretty significant, like a tenfold difference between the first and the bottom country. If we color code them by continent, we have white as Europe, dark blue is North America, pink is South America, and yellow is anywhere else. And what you can see is that Europe has been the most seriously impacted. But if you look at the rate of growth just over the past week, what you can see is that it's growing most rapidly in South America now, followed by North America, and much more slowly in Europe. Pretty significant numbers, too. There are 8 countries that just in the past week alone have grown 10% in their total deaths per million. So pretty significant growth. So even though the U.S. rate is lower than that, obviously there is still some significant risk of international travel. Within the U.S., we had our first reported case the first week of March. About 3 weeks later, we had hit 400. We hit almost 10,000 6 weeks after it began, and it's been growing rapidly ever since. And we passed 100,000 by the end of May. And now here we are at the beginning of July with 132,000 deaths and 2.9 million confirmed cases for something that was basically unknown more than 4 months ago in our country. In terms of overall deaths, in a normal 6-month period, these would be the number of deaths that we would have expected from the top 10 causes of death. And that's where 132,000 would fit into this list. We've been following the cumulative deaths, the change week over week. Early on, there was very rapid growth in the number of deaths in the U.S., and then it began to slow down nicely until about 2 weeks ago when there was a slight uptick, and then we're back down again. But what this tells us is that for about 6 weeks, there's been consistent growth in the U.S. We're not leveling off. We're still continuing to increase slightly. And this is also true with hospitalizations. Again, early on, there was a tremendous increase in the number of hospitalizations. It slowed down, and then a couple of weeks ago, we saw an increase, and it's been growing at about 4 to 6% for a month and a half. So that's still pretty significant growth, and it tells us that we're still seeing a significant pandemic in our country. Here's all 50 states. Again, tremendous variation. But if you color code it by region, pink being the Northeast, dark blue being the Midwest, yellow being the South, and white being the West, you can see that by far the Northeast has been the most heavily impacted part of our country, with the Midwest and the South following and the West being the least impacted. But if you look at growth over the past week alone, it's just the opposite. And again, we see this pattern where the South and the West are growing more rapidly. The Northeast seems to be slowing down a little bit in their rate of growth. And again, we have about 7 states that have had more than a 10% growth just in the past week alone in terms of deaths per million. Now, why would we be seeing lower rates in the more heavily impacted countries and states? Because they were, there's really 4 possible reasons. One, because they were so severely impacted, the population has been more willing to self-isolate, practice social distance, and wear masks. Probably there's a big element of the pandemic struck larger cities where the virus can spread very rapidly. And because these cities have such a disproportionately large population, it impacts the overall numbers. And there's at least a possibility that there may be an ultimate size to the pandemic. In New Jersey, 1,716 per 100,000 is 0.17% death rate. And some have estimated that the COVID-19 death rate is 0.3%. So maybe there's some maximum number. We don't know. I suspect there's some combination of the above with a special, I think when we learn more about it, we'll discover that it really was large cities where it spread first and had the greatest impact on overall numbers and is now slowly spreading into other areas. There's a lot more information about COVID-19 on our website. Please feel free to go and hit this icon. And if you have any questions, please let me know. I'd be very happy to try to find an answer. Thank you very much.